Hey everybody, and welcome back to another episode of the Pup and Away podcast. My guest today is Dr. Kevin Toman. I probably should have asked him if it's Toman. I think it's Toman. He goes by Dr. Kevin. And he reached out to me with the idea of being on my podcast, and I was a little bit reluctant because while he does talk about canine longevity, which is one of my favorite topics to talk about, he is also someone who really believes in the use of rapamycin, which is a drug that is being used to increase our dog's longevity. And when I first heard about it, I was skeptical, as I tend to be about most pharmaceutical things like that, of that nature. But I really wanted to hear everything that he had to mention. So I said, yes, come on the podcast. I'm going to grill you about rapamycin. And our conversation really was just, it was fantastic. I think probably one of my favorite conversations that I've had on this podcast. I love bringing people in that maybe I don't know too much about, because I think we learn the most whenever we have kind of healthy, open dialogue that maybe you don't already know that you completely agree with someone, I guess. So Dr. Kevin Toman is a veteran small animal veterinarian, founder of Helping Pets Live Longer, or HPLL, and one of veterinary medicine's most vocal advocates for longevity first care. After 4 decades in clinical practice, he recognized a stark reality. The veterinary world is 20 years behind human longevity science, and pet owners are starting to notice. HPLL bridges that gap. Drawing from validated research in longevity medicine, oncology, metabolic health, and functional diagnostics, Dr. Toman offers pet owners something rare, a clinician who blends medical rigor with genuine compassion for the human-animal bond. I'm going to start that one all over again. HPLL bridges that gap, drawing from validated research in longevity medicine, oncology, metabolic health, and functional diagnostics. Dr. Toman offers pet owners something rare, a clinician who blends medical rigor with genuine compassion for the human-animal bond. His protocols span evidence-based supplements, advanced diagnostics, and prescription longevity therapies, rapamycin, acarbose, and metformin, applied carefully and individually to dogs and cats. Beyond direct patient care, Dr. Toman partners with holistic and integrative veterinary practices nationwide, providing turnkey longevity infrastructure, private label supplement programs, and continuing education for veterinarians who want to offer more. So without further ado, let's hop into our conversation with Dr. Kevin Toman. Hey everyone, and welcome back to another episode of the Pup and Away podcast. You know me, I'm your gal, Steph, the pro dog mom, certified dog trainer, canine behaviorist, and canine nutritionist in San Antonio, Texas. And today I'm joined by Dr. Kevin, who is also known as the longevity vet, which you guys, Dr. Kevin, I don't think I've told you, but or maybe I did mention it in our emails. I have a 16-year-old Schnauzer. And so the idea of, longevity, what can we do to help our dogs age more gracefully, is definitely a topic that I have been exploring a lot recently.
Okay.
Yeah, because, him being 16, we're obviously going through some of those things, arthritis. We actually have our first acupuncture appointment today. So, when you reached out to be a guest, I was like, this is exactly the rabbit hole that I love.
Great timing. Perfect.
Yeah, because there's obviously lots of different rabbit holes that we can go through. So, before we jump more into it, Dr. Kevin, do you mind telling the listeners a little bit about you?
Happy to do so. And first off, Stephanie, thank you very much for the opportunity to appear on your podcast. And I also want to mention to your listeners that I tiptoe into the podcast world, and so I know exactly how much work it is to put these podcasts on. Yeah. So Stephanie, thank you very much, not just from me as a sometimes listener, but also from all your other listeners, because you're providing a tremendous service to the dog owners around the world.
I appreciate that. Thank you so much.
Yeah, and so with that being said, my name is Dr. Kevin, and I've been a veterinarian since 1986. I've practiced primarily in small animal practice throughout the United States, the western component of the United States, especially California and Colorado. And most of those practices were centered in more rural areas, so I got a fair share of emergency work. I did everything that walked in the door, whether it be vaccines or plating a bone or removing a spleen. So I really got a wide variety of experience in veterinary medicine. Now, about 10 years ago, my practice shifted, and we can talk more a little bit about that if you wish. But my practice shifted to exclusively the care of older pets and the challenges that they run into, whether it be cancer care, chronic pain, or heart or kidney disease. I mean, those are kind of the big four in many of the pets that I help. And I do this via a combination of concierge consults, online via telemedicine. I use prescription longevity drugs like rapamycin and acarbose, and I use supplements that have been proven over 40 years of veterinary practice.
All right, very cool. I do want to know what kind of led you down. Like, was it a specific dog? Was it your own dog? Was it a client? A specific something that
Yeah.
made you think like, I really want to focus on the old guys.
Well, so she ended up being my dog, yes.
Okay, yeah.
And so this was a favorite client with a favorite patient of mine. The client's name was Esther, of all things. And she was an older gal, as her name might imply, and she ended up dying while she was caring for this 11-year-old Cavalier King Charles Spaniel named
Oh,
Phoebe. And so we thought that Phoebe was going to have to be run through a shelter setting because Esther had she had no husband at that point in time. She had no relatives that wanted a dog. And I just felt like it was heartbreaking to ask an older dog. And as a Cavalier King Charles Spaniel, Phoebe had a heart murmur. She had some of the arthritis issues that you've spoken of with your dog. And so her odds of successful adoption going through a shelter were very low. And this was just heartbreaking to me. And so I have been working ever since with shelters centered around the care of older dogs who have effectively been orphaned when they're older, when their caregivers had to end up in a nursing home or when they in fact died, leaving these pets to fend for themselves.
yeah. Okay. So did you end up like adopting Phoebe and she
I
became?
forgot, I left out the punchline there. Yes, I ended up adopting Phoebe, the wonder dog, and she lived with us for another 4 years before
That's
her heart gave
amazing.
out. And
Oh,
so that was a crash course into the benefits of longevity therapy for her
yeah.
because she had been given 6 months to live by a veterinary cardiologist. And so we were able to
Wow.
get 4 years of good life for her, walking and running and, and occasionally dipping her toes into the water of the beach. And so she lived a life in full. And I attribute that to the lifestyle that we were able to give her.
I love that. Yeah. So talk about a crash course for sure. You had any like other older dogs in the past, or was she kind of your first senior dog, or like what kind of was it about?
She was the first dog that I had adopted at that point in
Okay.
their
Yeah.
life. Like most folks, I had purchased or adopted younger dogs and seen them through their illustrious careers. But this was the first time that I had adopted an older pet like that,
Okay.
and it was not the last. I mean, since that time, I've adopted two other older calves. In an effort to go ahead and give them the better home than they were in at that point in time. And I currently have an 18-month-old golden retriever puppy named Annabelle.
Wow. Okay. That's been a lot of fun, I'm sure. Most
Most
times.
times.
Yeah. I own a dog training boarding daycare facility here in San Antonio, Texas. And while I don't deal a lot with rescue because that is a very, very, very hard part of the pet
It
care
is.
industry, so freaking hard. But I do partner with quite a few rescues, and one of them, shout out to Bandera Dog Rescue Mission. They got a lot of, I think almost 100 dogs off of this hoarding situation, this hoarding facility over in Bandera, Texas. And we took in a few of their fosters. Some of them moved really, really quickly. Some of them did not move very quickly. And of course, the troubled kiddos, we had a death pity for a little while. We have one gal who's very social, but she killed a cat. But the reason why I'm bringing this up is because of Bandit. Bandit is a senior dog who had he's had like two really big surgeries. I'm not going to get the names correctly, but he had the thing where like his little pee would always kind of stick out, so they had to do a lot of repair on that. And then he had some really crazy like bone on bone stuff going on in his back, and so they did a repair on that, and then the screws ended up getting infected, so they had to do all kinds of stuff.
Oh gosh.
Yeah, so luckily though, we just found out that he just got adopted. He went to a foster not too long ago, finally got adopted. So it does happen for these senior dogs. And so thank you to anyone and everyone who fosters senior dogs, considers adopting senior dogs. I mean, it is hard. My heart always goes out to the senior dogs. I think I like schnauzers because they look old, and then when they turn old, also I'm like,
They do look old.
this is extra
Yeah.
love. So I'm always a sucker
Yeah.
for the seniors. Now, you mentioned that you have a lot of different modalities in your practice, and you mentioned a lot of herbs. Do you consider yourself a holistic veterinarian, an integrative veterinarian? Like, how do you kind of identify?
Well, okay, yeah. So that's a fair question because there's a lot of different names, and
Yeah.
integrative and holistic, I think generally are considered synonyms. They kind of mean the same thing. But a lot of people will ask me whether I'm a naturopath, and the answer is clearly no. I believe, Stephanie, that a pet, whether it be your schnauzer or my little girl Annabelle, they are best served with a combination of therapies. And so, listen, I graduated back in 1986, long before you were born. And at that
Wow.
point in time, I was told that, that you really, that the way to cure pets was with scalpel blades, with pills, or with injections. And I still use those things to this day. But I also use herbs. I also use acupuncture. I also use laser therapy. I also use things like prescription longevity drugs, rapamycin as an example. And so it's my belief that the more different approaches that you and I can use for a pet, the longer and happier they will live.
Yeah, I love that. Was that something that came into practice a little bit later, or were those things like acupuncture and herbs something that you were practicing back in the 80s?
Well, I'll tell you the truth. And when I turned about 44 or so, the short version of this story is that I was wrongly diagnosed, excuse me, with cancer.
Oh, shoot.
And so I jumped through a bunch of hoops and found that I had a precursor condition to a very serious type of cancer, but not the cancer itself. So
Wow.
just like you, Stephanie, the first thing I did after this diagnosis was I went out and read a bunch of books at that point in time and hit the web, such as that existed back then, to try and determine what I could use to minimize the chances of that progressing from a precursor to the actual cancer. There was not one drug that would help me solve that, but there was a particular spice or herb called curcumin, which was proven to slow or sometimes stop that progression from occurring. So right off the bat, I became a curcumin kid. I became an herbal therapist by definition, and so when I first did that research, I looked across the world for the best herbs, the most proven, the purest supplements that I could find for my own benefit. I was very selfish at that point in time. I wanted them for my use.
Understandable.
But what I learned was that there is a tremendous amount of evidence. There are a variety of different supplements, natural herbs, etc., that you and I can use not to benefit just our health, but also to benefit the health of the pets in our care. So that was really my opening to integrative therapy, and it was my illness or my health issue that created that opening for me.
Yeah. Why, and I don't know if you have an answer to this, but why do you think vets aren't like taught those sorts of modalities in vet school? Is it just because there's so many things to cover that, we just tend to focus on the scalpels and the injections and things like that? Or do you think it's not something that's really understood? I think especially in this part of the world, like what kind of makes you think why isn't that taught in vet schools?
I think it's tradition, to be honest with you. And I'm going to make a statement here that you can edit out if you choose, but I think that the current veterinary medicine as the industry of veterinary medicine is broken. And I make that statement because very few veterinarians are able to build relationships with pet parents like you that enable them to follow their patients from early childhood, so to speak, all the way through adulthood and then eventually
Yeah.
into their senior years. And many veterinarians are employees of corporate practices. And if that's the case, if Stephanie, if you are the veterinarian that's employed by a corporate practice, you are told that you can't spend any longer than 15 or 20 minutes visiting with a patient. You are told what medications you can use. You are told, you're given a budget for that pet, and you are told, oh, by the way, that your compensation, your salary, Stephanie, is going to be 21 to 23% of the profits that you generate for that practice. Mm-hmm. And you tell me where in the things that I have mentioned, where those dictates from corporate practices gel with offering our pets the very best care. They simply don't. They simply don't. And so that you asked me a question about vet schools, and I'm going to tell you that vet schools are very traditional. They wedge an awful lot of information into 4 years of a vet student's life, and I speak from personal experience there, but they are not known for exploring the latest. Vet schools traditionally run about 10 years behind the times, to be honest with you. And so the hope would be that the next 10 years allows them to spend more time on longevity science, more times on herbal therapy, etc., because it will benefit our patient care during that time.
Yeah, I think one very interesting thing that you hit on that I've honestly never really thought about is, we have a vet. Hopefully we establish a relationship with a vet in early puppyhood or as soon as you get your dog, whatever age that is. And ideally, this is the vet that you see all throughout your dog's life, but that's not the
Yes.
case for us, right? We see a pediatrician when we're younger and eventually age out of that. We see a specific dentist, a specific eye doctor for all these different, body parts, but that's not really something that's really quite explored in the vet industry. And vets have so much to learn. I mean, just the pure generalized knowledge that one must have to do cats and dogs and sometimes exotics and large animals, and you have to do consultations and vet appointments and prescriptions, but also know how to do surgery. It's a lot. I used to want to be a vet, and then I realized that I was bad at chemistry. And so just
Well,
that
if you had gotten through college chemistry, you would have been fine because I don't use chemistry in my day-to-day practice. But here's how I would respond. I would tell you that I think whether you walk on 2 legs or 4, the best medicine is a relationship-based medicine where I recognize you, Stephanie, as you walk in the door. I give you a hug. I welcome you. What's your schnauzer's name, by the way,
Sully.
so that we don't... Sully?
Sully. Mm-hmm.
Okay. Yeah, and so I recognize Sully when he comes in the door, and I'm able to talk about, the things that you guys have done recently. And then we move on to what has happened in Sully's life. Why are you here? What do we need to look at? But a 15 or 20-minute appointment interval does not give a new veterinarian. If you're seeing a different veterinarian every time you walk in the door of your clinic, the reality is that most times they don't have a chance to look at your case documents, your history, before you walk in the door. And so they're spending the first 10 minutes or so of a veterinary appointment just trying to learn what has gone on with Sully's health care in the past before approaching what is going on right now. And I'm going to tell you that the reality, what I do, the longevity science component of it, Stephanie, this is not just a 10 or 15 or 20-minute process. Veterinarians do not have the time to sit on the floor and to ask questions about what scares you about Sully, what worries you, what has gone on in Sully's health past, and how do we address that to make sure he lives his healthiest life in the future. That takes sometimes hours of conversation or teleconsults and the like. And that's something that veterinarians these days just simply don't have the time or the knowledge to do.
Yeah, I agree. Oh, I can unpack that so much, but I think I've kind of unpacked that in other episodes, and I really want to focus more on the longevity stuff because, me being someone who's a little bit more holistic minded, and in Texas, it's very hard to find. I mean, I go see an integrative vet, and she's the one that does our acupuncture, but she frowns upon me feeding raw or gently cooked options and things like that. So I tend to have many different vets depending on what it is that I need for my dog's care at that point, which is very challenging at times.
Yeah, I understand.
Yeah, Yeah. So okay, let's kind of shift everything back over again to senior dogs. I think that's our biggest topic of conversation today in longevity. Period. When you have a senior dog that walks into your practice and you've never seen them before, it sounds like you do a lot of relationship establishing with the client, which is super amazing and awesome. But what are some of the things that you're looking at as far as your exam with the pet that maybe some traditional conventional vets may overlook, or kind of like what might set you apart in that exam?
Well, I would tell you that a good physical examination should always be part of a veterinary visit. That's clearly one of the primary goals. And there are tricks to the trade. I probably do a better physical examination now than I have ever done in the past, simply because I've learned what to look for and where to spend my time. But taking a step back from that, Stephanie, I would tell you that when I think of longevity as a whole, I really think of it as kind of a four-legged stool or four-legged chair. The first component of that longevity science is diet and lifestyle. So we would talk an awful lot about your pet's raw diet, your pet's gently cooked diet, to use your phrase. We think about where you let Sully spend his time. Is he spending a lot of time on golf courses where toxins are a potential concern? Is he spending time on the beach where you have to worry about infectious diseases like leptospirosis? We would talk about his vaccine past, because unfortunately, I'm going to tell you that vaccines are many times overused. Let me repeat that, overused by veterinarians, and I tie that directly back into the profit motive of their employers. And then after we've talked about diet and lifestyle, then we move on to their current veterinary care, because I'm going to tell you that for a boy like Sully, he should be having anesthetic dentals once a year, and we can talk more about that. He should be having routine diagnostic tests, blood and urine tests, because schnauzers, bless their little hearts, they're prone to diabetic issues. They're prone to kidney problems. They're prone to some forms of cancer, and the earlier we catch these diseases, the better off we are at postponing or keeping them a mild problem. And then we talk about supplements, because the supplements that Sully might benefit from are far different from the ones that I might use on my golden retriever. And so one supplement does not fit all dogs or all cats. And finally, we would talk about prescription longevity drugs like rapamycin or acarbose, drugs that have been proven to benefit lifespan by up to 14% in every mammal species studied to date. And so, that's kind of a rundown of the approach that I would use as part of an office visit centered around longevity.
All right, very cool. It sounds very balanced, and I really love that one of the things that you touch on is the diet and the environment, because I think that's often something that's missed a ton when I have conversations as a client with conventional vets. They'll ask about diet, and they usually want to prescribe something that looks like pebbles in a bag, and they never really ask about environment. Well, what sort of things, where does Sully spend his time? What sort of cleaners do you have in your home? Do you use a lot of fragrance? I think all of those things are usually kind of missed in those conventional conversations. So it's really cool that you chat about that pretty much right off the bat. What are some of your favorite go-to holistic tools? Like you talked about acupuncture. Do you do like chiropractic? Obviously, you talked a lot about herbal things. So what are kind of your maybe like top 3 or 4 of your like, these are usually things that I'm reaching for from my holistic tool bag?
Well, and I listened to your question. I would say that before I reach into the tools in my holistic tool bag, I want to use a combination of my experience and the tests needed to fully understand a pet's health issues. So, for Sully, I'd be paying attention to his lab work. I'd grab a urinalysis from him to see if he, like bazillions of other schnauzers, have any evidence of urinary stones. I would be paying attention to an echocardiogram, just to get the best assessment of his heart. But once we have an accurate diagnosis, then, and you've spoken very directly to his arthritic discomfort. You and I would talk about ways to help him lose weight, because every ounce of extra weight is going to create a health issue, create worsening pain for your boy. You and I would talk about minimizing stairs in his environment and looking at the flooring that he is on so that when you get home from work, Stephanie, he doesn't, come running around the corner, slip and fall.
Yeah.
Because every time an older dog slips and falls, that injury is permanent. It may just be very minor, I admit that, but every time a dog slips and falls, or every time they go running up or running down a set of stairs, it is shortening their life. And so you and I have to have the best understanding possible of the underlying causes of their pain. And then speaking directly to arthritis, I'm going to tell you that there are supplements that have been proven not to work before we talk about supplements that have been proven to work. One of the best examples of that is, listen, I sold glucosamine chondroitin products like Cosequin and Dasequin for well over 20 years in my veterinary practice. Well, now we know they don't work. They just don't work. Glucosamine and chondroitins don't work to help your painful joints, and they don't work to help my pet's painful joints. And there are things that do work, things like undenatured type 2 collagen or UC2, things like CBD, things like fish oil. I mean, there are a wide variety of supplements that you and I could choose from to help an arthritic pet. And one of the other treatment modalities that you should be very aware of with an arthritic pet are the benefits of laser therapy. For acupuncture works for many pets. Laser therapy works for virtually all. And so, yeah, there are a variety of different ways that you and I would address your pal Sully's arthritis. And that includes, by the way, there are some fascinating new treatments for arthritic pets, things that we've never been able to do before. And listen, I mean, I'm a huge believer in eliminating pain the old-fashioned way. I don't believe in saying, oh, he's just having a bad day. Look at him limp. If your pet is painful, they should be on allopathic pain relief as a basis for everything else. Now, you and I can work to help their pain in other ways, but listen, there's nothing more important to me than stopping your pet's pain.
I feel so validated in some of the things that you said. Yeah, we do a UC2 undenatured collagen. Check, check, check.
Atta girl, atta girl. Now you're talking.
Yeah, we do a CBD. But one thing I'm like, ooh, I gotta change that. So we do have some stairs in our home, not in our home, but to go outside to the backyard. He goes down, I think it's 7 steps. And part of me is like, I want you to keep moving. So I almost kind of encourage him to go up and down the stairs. But now it sounds like maybe that should be something that I'm not encouraging, but encouraging movement in simpler, easier, lesser impact ways. Is that correct?
Absolutely. Let's think about it in a couple different ways. On an evolutionary basis, dogs were walkers and trotters and runners, but there were no stairs in their environment.
True.
And so when you and I go, I mean, the average schnauzer is going to be 16 to 18 inches tall. The average stare is 8 inches tall. And so it is no different whatsoever than, I'm about 6 feet. And that'd be like me going up and down 2.5 foot stairs, taking 2.5 foot box jumps in and out, time after time after time. And
Yeah.
that is cumulative. I mean, the reality is that my advice to you would be either, I mean, I don't know how many times you have to go up and down those stairs. And if it's just once or twice a day, I fully understand. Hey, that's life. But if some people go up and down stairs, 20 times a day as part of their job, and their dog or their cat goes with them 20 times a day. And for those pets, the simplest way to solve their or to minimize their arthritis is to buy a child's gate at Walmart for $30. Put it up so that they go up and down stairs once or twice a day. But the other 17 or 18 times that you go up and down a set of stairs, they're stuck on one level.
Yeah.
And the other thing that I would mention is, the slips and falls. I mean, the reality is that if you have hardwood floors or if you have tile floors and Sully comes running to see you as you get home from work, slips and falls, these are cumulative injuries. And all it takes is one particularly bad injury, and you could be looking at making major decisions around his health care. Do you want to spend $4 or $5 or $7,000 for an ACL repair at his point in life? I mean, these are big decisions that can be headed off many times by just a simple used yoga mat, in
Yeah.
that corner where he tends to spin out. Or again, going to Walmart and buying a $20 throw rug with a little rubber backing to it.
How do you feel about the or were they like toe grippers? Like you put little.
They help, but they're a pain in the ass for you, and they're a pain in the ass for your dog or for
Gotcha.
your
Okay.
cat. I mean, because you have to, a dog's nails have to be long enough, so that the glue has adequate surface area to set,
Mm-hmm.
and then dogs a lot of times will chew at them, and they fall off, and so they're not a permanent repair or permanent improvement to your dog's physique in any way, shape, or
Yeah,
form.
for
Now,
sure.
they do benefit your dog's traction, but the reality is that if you have that extra old yoga mat laying around, or if you have a rubber back liner that you can put under a 3 or a 5 foot throw rug, these are permanent solutions for your boy, and
Sure.
with a lot less nuisance value for you.
Gotcha. Gotcha. All right. Good advice. I love when I get to have a conversation and walk away with some actionable items. So, not eliminating, but lessening stairs. He doesn't go up them a ton, but I mean, I'd rather, the way that when you mentioned like going up a box jump, I just imagine myself blowing a box jump one time and never
Yeah,
wanting to get on it again.
yeah.
So
Sounds
you
like
put
you're
things
a,
into
it sounds like
perspective.
I'm happy you know what a box jump is. It sounds like you dabble in the gym world, and I'm kind of a gym rat myself, and
Oh, yeah.
yeah, and if you and I think of life as a series of box jumps, it helps to eliminate those stairs pretty quickly for your boy.
Exactly. Yeah, I have a forever scar on my leg that will always remind me of
I
that
understand.
one
I
fatal
understand.
box jump. Let's switch gears a bit to, we talked a lot about arthritis and things, but the gut. The gut is definitely something that I love a ton. I'm first and foremost a canine behaviorist, and what kind of like led me down the rabbit hole is of just holistic, I guess, pet care advice was the gut, because I learned so much about how much the gut can play a role in behavior, and when I learned more about that, it really kind of changed how I operate as a behaviorist. And so the gut is always something I love to talk about. And it seems like the majority of pet professionals that I talk to, we're all noticing just how freaking important the gut is. So can you talk a little bit about, the importance of a healthy gut microbiome, and, maybe is that something that we should be looking at a young age to help support how our dogs age? Or, can you kind of walk us through your thoughts around the gut microbiome?
Yeah, absolutely. And to be clear, when I graduated back in 1986, the reality is that we didn't have that knowledge either.
Yeah.
So don't sell yourself short. I mean, veterinarians of my demographic, very few of us would have been able to answer those questions for you when we first got out of school. But you're right. Over the last 20 years, there's huge evidence and increasing evidence of the role that our guts play, not just, when it comes to vomiting and diarrhea and nutrient absorption, but also actually in brain health and in kidney health and in musculoskeletal health. Because the inflammation that starts in your intestines, in particular, many times spreads throughout the rest of your system and will in fact shorten your life. And so, everybody talks about prebiotics, but there's also the probiotic component. What do we have? How can we enable the beneficial bacteria to get through the stomach in whole fashion before they get into the intestines where they're absorbed? And but I'm going to take a step back and discuss diet at large for just one moment for the benefit of your listeners. One of if you're looking at the very best way across species lines, dogs, cats, mice, fish, elephants, whatever, what's the best way to help that individual live longer? It's calorie restriction. That is the one thing that's been proven across all species lines, Stephanie. And in fact, there was a study done by the Purina Dog Food Company a decade or so ago. And what they did is they took litters of Labrador pups. Half of those litters they fed whatever they wanted. The other half of the pups they fed at about 75% of maintenance ration. And they followed them throughout their whole lives. Everybody, on the one side, they're fed as much as they wanted. On the other side, they're just fed 3/4 of maintenance. And what they found, Stephanie, is that the thin pups lived up to 1.8 years longer on average
Wow.
than the fatter pups did. And these were exactly the same dogs in exactly the same environment. There was no other change. And so if your clients are thinking about gut health, and in terms of longevity, I'm going to tell you the first thing we need to think about is how much food we are feeding them. The second thing we need to think about is the quality of those food. And by the way, I agree 100% with your thoughts on raw diets or gently processed foods. We can talk more about that. But the third component to this is understanding your pet's GI tract. And now I recommend microbiome testing for virtually every patient that I see as part of a longevity workup, because we can identify very specifically what bacteria, what fungi, what protozoa are in their in their pet's stomach and intestines. And as funny as it sounds, if there are deficits, there are companies that now make prepackaged supplements consisting of just this type of bacteria or just that type of bacteria that you and I can add into our pets' diets to restore normal gut balance. And so I 100% agree with your concerns around gut function.
And I love that you go to that gut microbiome test because, and again, I think that's something that's kind of missing in those conventional veterinary conversations. Just even speaking of my relationship with my integrative vet, it's, what are you feeding? It's not, maybe we should explore actually what is in your dog's gut. And then, that's kind of one of the conversations I have with my behavior clients, because there are specific species of probiotics that are clinically proven to help the body deal and regulate with stress and all that kind of fun stuff. And so, if the gut is already funky and not okay, let's first address that and find out what strains should we actually be focusing on, instead of just, I don't know, picking some random thing off of the shelf and just hoping that it works, right? And so kind of having that knowledge to have better curated support for that dog, I think, is super important. I think it's really cool that you pretty much have everyone start off with that. Is there a specific gut microbiome test that you like, or is it maybe one that you only have?
Yeah, I like a company called Animal Biome.
Yeah. Okay. Cool. Love those guys.
Yeah,
Very nice.
they're very responsive. They do a great job, and so happy to plug them without compensation. I make no money from them. I'm not associated with them in any way. But if you're looking for a microbiome test, Animal Biome is the one that I would recommend.
Yeah, that makes me, again, feel validated. That's usually the one I recommend to my clients as well. When you speak to clients about nutrition, say, for example, again, you have an older dog walking into your clinic, I'm sure you do a very deep history as to what has your dog eaten in the past, what is your dog currently eating, what are some of the more generalized, pieces of advice do you have around diet? Do you typically try to get your client to go for a raw? Do you try to get them on a gently cooked? What does that kind of conversation kind of sound like from your end?
Well, the hard part is that there are many preconceived notions that people come in with, or and there are many preconceived notions that are baked into a client's head by virtue of their previous veterinary care. Mm-hmm. And so, in general, I'm going to tell you that that whatever you and I can do to typically reduce the amount of calories that your dog or your cat is eating, in general, that's going to confer a longevity benefit. In general, I'm going to tell you that whatever we can do to increase the quality of your pet's food will also be a benefit. And one of the things that the Dog Aging Project, which is this decade-long study that's being done centered around pet longevity and the use of rapamycin, as an adjunct, they have found that just feeding your pet once daily, feeding your dog once daily instead of 2 or 3 times, it leads to fewer health issues. Now, I haven't told my golden retriever puppy Annabelle about that because, that would kill her. She's very food motivated. But the reality is that if you and I were building a new dietary strategy for a pet's longevity, we'd have to consider whether it was best to feed that pet once or twice or 3 times. And clearly, after they get out of puppyhood, the answer at this point seems to be just once. When it comes to the actual dietary ingredients, like you, I'm a real believer that the fewer preservatives we put into a pet's diet, the fewer artificial flavorings, the longer that pet will live. And so, although, as a 66-year-old, I fed my dogs kibbles for probably 50 of those years, because they're certainly the easiest, the most convenient. You just go to the store and pick up a bag of kibbles. Mm-hmm. But one of the things that has become clear over about the last 7 years or so is that kibbles are not a healthy way to feed our dogs. And I say that because those kibbles or pebbles, as you describe, are glommed together. The thing that allows them to stay together as a little pebble is extra carbohydrates or extra sugar. So by definition, virtually every kibble diet is going to have a higher sugar content than a non-kibble diet. And then you run those sugars through a 450 to 475 degree oven to bake them. And what happens is you create carcinogens. You create cancer-forming molecules like advanced glycation end products or AGEs. And so these things are clearly telling us that kibble diets are not what we thought they once were. Now listen, I fully understand. Not every person can get away from a kibble diet, even if we understand that they are not, in fact, the very best way to feed our pets. But maybe if that's the case for your listeners, maybe here's what I'd propose. Maybe use instead of making a kibble 100% of their diet, make a kibble 50% of their diet and rely on fresh chicken or fresh veggies or fresh fruits for the other half of that diet. And I think your pet would be an awful lot healthier as a result.
Yeah, I love that. And I think that's, again, kind of another theme that I hear a lot from pet professionals, especially from the holistic side, is we're here to meet the pet parent where we can. If you're just like, I will absolutely not feed my dog raw, period, I'm like, dope, it's good for me to know that. But maybe what are some other ways that I can help you get that bowl looking a little bit more fresh? And
Yeah.
those simple changes, right, are definitely, I mean, that's how it started off with me. I used to also feed my dog kibble. I started off my career in the vet industry, and that was very much something that, we practiced a lot. We sold bags of kibble and things like that. And little small changes, and then those rabbit holes led me down another rabbit hole, which led me down a water slide. And then, it just kind of grew from there to the point where both of my kiddos have been on, Sully is now on a gently cooked. He now does not do well with raw anymore. But every time I make a change to their diet, like when they went from kibble to raw, I saw a huge improvement in their body, not just like their physique, but their mentality. Sully got a little bit more pep in his step. And then I started noticing his digestion was kind of slowing down there a bit. So I got him on gently cooked. And then again, I kind of saw another little revival from him. So it's quite nice to see those immediate moments of like, holy shit, that works. That's quite nice.
Yeah, there are a lot of holy shit moments. And,
Yeah.
and so, one of the things that, for instance, I've chosen to do with my little golden retriever puppy Annabelle is I home cook for her. And it's not fancy. I buy her some ground turkey, or we're fish eaters as well. And so we use a rotation of good quality protein meats. And then in addition to that, we use a rotation of vegetables and fruits. But one of the things that is always present in her diet is broccoli. Because as an example, I want the extra fiber of broccoli, but in particular, golden retrievers have about a 4.5 times higher cancer incidence than any other breed of dog.
We're
And
going to
so
that
I'm trying
sometime.
with every meal to reduce her cancer incidence. Let me try that again. To reduce her cancer incidence, because broccoli contains an ingredient called sulforaphanes, which are active cancer fighters. And so every meal she has, we may rotate her meat, we may rotate the fruit, we may rotate other vegetables, but every meal she eats contains broccoli, not just for its fiber, but because what I'm trying to do is to set the table for anti-cancer benefits longer term.
I love that. You're speaking all my language. I think I did a little reel about one of the best ways to prepare broccoli and how to get the most sulforaphane out of that broccoli. So, and I love that you're looking at that dog specifically and you're saying like, okay, what does this dog need? It's not a very generalized recipe. Or I love the idea of rotating things also. Even if I have a client that's like, I'm not willing to get off kibble, I'm like, okay, well, how can we change the recipes that we're feeding in the kibble and kind of rotating different things? And at first that might be a little bit hard and challenging because your dog is so used to being on that same bag of kibble. They've been on that for, the past year or so. But once you start introducing things and kind of keeping a rotation, changing things up is not that difficult. And then now you kind of start to see their body just kind of get more, I don't know, like different proteins and different fruits and vegetables and everything have different nutrient profiles. So let's explore all of those.
Yeah, so let me just make a couple of public service announcements here, as it were, for the benefits of your clients. First off, if you are going to use a home cooked diet, there's a couple of studies that show over half of them are not well balanced. And so if you're going to feed one consistent diet, please spend $100, $150. Have those ingredients analyzed by veterinary nutritionists. There are a bunch of them on the web these days. One of the most common is balanceit.com. And I have no financial interest associated with this company, but make sure that if you're home cooking for your dog, you're not inadvertently screwing them by not balancing their diet. That's
Yeah.
point A. Point B is the fact that, 20 years ago, there was a huge explosion in the popularity of grain-free diets. And, because nobody liked looking at their ingredients list of these kibbles, for instance, and seeing corn as a first ingredient, cornmeal as the second, and corn gluten as the third. That's clearly not a very healthy way to feed our pets. But one of the things we found out about 2 years after the huge influx, this huge bell curve of grain-free diets hitting the market, was we also found 2 years later a huge influx of dogs with heart problems because of those grain-free diets. And most grain-free diets are deficient in a particular amino acid called taurine. And unfortunately, taurine is necessary for normal heart health. And so, boys and girls, if you're going to if you're going to home cook for your pets, if you're going to use a grain-free diet for your pets, please, 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 if you listen to nothing else I say, listen to the thought that you guys need taurine. It's a cheap supplement. Yes, you can buy it from me, but you can buy it in 1,000 different places. And that is necessary to.
Hey guys, I'm going to interrupt this conversation with Dr. Kevin for just a quick second. I'm at the office doing editing, and I wanted to add something into, I guess, more clarity around the conversation about something Dr. Kevin just mentioned, and that grain-free causes heart issues. It has been found that was debunked, that the people that put together the study that claims that grain-free increases the likelihood of DCM, which is that enlarged heart condition, were actually fudging some numbers so that way they can boost their own sales, because there was all kinds of weird conflict of interest and really crazy stuff going on. So while yes, I do agree that taurine is very important for heart health, it has been debunked that grain-free causes DCM. It does not. So there's that for clarification.
Keep your dog from developing heart problems. The third and probably the final component to this is, Stephanie espouses raw diets, and I think that's wonderful because in general, I believe that the less processing that goes on, the healthier a diet is for me, and therefore the healthier the diet is for my little dog Annabelle. However, because I'm an old fart, I have seen two dogs very specifically die from raw diets by virtue of bacterial contamination. One was E. coli, one was salmonella. And the third dog that I mentioned, he got sick, but I think we lost him to another cause. And so the moral to the story is, if you're going to feed raw diets, make darn sure that you're well aware of what your raw diet provider is doing to help minimize bacterial overgrowth in those diets.
Yeah, absolutely.
Boom. Okay, now I'll shut up.
No, those are all great points for sure. I think any decision that we make as pet parents, there's always pros and cons to everything, right? I mean, kibble also has a lot of bacteria if it's not stored the right way and it's been on the shelf for too long. And there's been multiple recalls for salmonella and things. It's not just raw, right? So anything that we choose to do with our pets, there's always something to consider. When it comes to spaying and neutering, we're talking about how old are we going to do that at, if we're going to do it at all, vaccinations, and I think that's kind of a nice little segue into the next thing that I kind of wanted to chat about is, conventional practices that may or may not be aging our dogs faster. You kind of mentioned like over-vaccinating not too long ago. Perhaps maybe spaying and neutering might be on your list, but what are some of like the conventional practices in the vet care industry that maybe we over prescribe or overuse that might be aging our dogs quicker?
Well, I think that every dog and every cat is an individual. And what would be healthy medicine for one dog or one cat may not be healthy medicine for another. And so one of the things that I firmly believe is that the best medicine of all is relational, as you and I have talked about already, but it's also customized for an individual pet's needs. And so when you describe vaccinations as a concern, the reality is yes, clearly they are. When I was graduated from veterinary school back in 1986, I was told that every pet needed every vaccine once a year. And the reality is that that was probably more centered around economics for the veterinarians than the health needs of a pet. And now we're learning that clearly, I mean, the vaccines are widely overused. Now, listen, especially in Texas, everybody needs a rabies vaccine. I'm not going to belabor that point.
Yeah.
But does everybody need a distemper parvo booster on an annual or second or maybe even a third year basis? We'll talk more about that in just one second. I'm going to suggest to you that leptospirosis vaccines may be of value, may not be, but vaccines like kennel cough and the canine flu probably have no role, let me repeat this, zero role in your pet's health and likely contribute to immune overload that may shorten their life. And so I think that, again, every pet ought to have, when your veterinarian asks, let me try this sentence again. When your veterinarian tells you that your pet needs a vaccine, my suggestion to you is that you ask why. Let them explain why your pet is at risk for this particular disease. Now, I'm not uniformly anti-vaccine because, again, as an old fart, I remember when canine parvovirus first came through the dog population, and it killed everything in its path. It was a bloodbath. It was the apocalypse for dogs. And now, now that we have such good vaccines, we can prevent that. We can 99% prevent that in the average dog through the vaccines that we are using. So I'm not espousing a vaccine-free existence. That would be shortening your pet's life rather than increasing it. But if you want your pet to live their longest and best life, ask me why when I recommend a vaccine.
Yeah, I love that because every dog's different. It depends on, are you going to doggy daycares and things like that? But even still, like, the flu vaccine is not required for us to be out in public places, and the flu vaccine is not going to cover everything that that you might be exposed to that year. So there's a lot of still kind of those holes. So yeah, I think it really just depends on, again, your pet's lifestyle. If you're going to those beaches with maybe your exposure to lepto is a bit higher, then maybe we will consider that.
Yeah, yeah. Let's talk about Bordetella and the flu vaccine for just one second, because I'm sure that in your line of work, Bordetella is a big issue for you. But I'm going to tell you, I'm going to tell your listeners the honest truth. And Bordetella vaccines are typically good for 3 months at a spell, just 3 months, not any longer. And so if you go in January and your veterinarian tells you that your pet needs a Bordetella vaccine and you're not going to be boarding them, or you're not going to be visiting Stephanie's kennel or Stephanie's training facility until April, well, why in the world would you allow them to give your pet a 3-month long vaccine? Let's wait. If you're going to visit with Stephanie on June 1st, then mid-May, let's you and me get together for a Bordetella vaccine. That makes sense to me. But if you're visiting with Stephanie on June 1st and you're vaccinating your dog anywhere prior to the 1st of May or so, you're wasting your money, and you're probably creating penalty points for your dog from a longevity perspective. And when I think about the flu vaccine, I'm going to tell you that most veterinarians are now calling this the Merck vaccine, because Merck is the company that makes the flu vaccine. Guess what the incidence of canine flu was in 2025 in the United States? There were 11 cases.
Oh, wow.
11 cases. 6 of those were in California. 4 of those were in Georgia, and 1 of those was in Virginia. There were no other cases in any state of the United States. Of those cases, how many dogs died? 0. And yet veterinarians are recommending flu vaccines left and right. There is no rationale. There's no rationale in the world why the average dog needs a flu vaccine unless you're going to be traveling to one of those endemic areas or mixing your dog in with a pet from that area. So again, guys, just ask your vet why, because if they can't explain why your particular dog is at risk for this particular disease, my advice to you is to call timeout.
Yeah, vaccine math is so wild. I had no idea that a Bordetella vaccination was only good for 3 months, yet no one says come back in 3 months to get it. It's always 6 months.
Just
So
3 months at a spell. Yeah.
yeah, that's wild. Okay, not that I encourage people to go get even more vaccines, but that just doesn't make any sense to me. Why are we
Yeah.
sometimes pushing vaccines more than what we're supposed to, but then we're not pushing some vaccines as often as they are labeled to work? Like that just
Yeah, in your shoes, if you were concerned about Sully contracting contagious disease, contagious respiratory disease from your clients, then you'd want to vaccinate him 4 times a year.
yeah.
Now, the hard part is, Stephanie, speaking to your particular circumstances, we think that there are 5 or 6 different organisms, different bugs that cause the canine upper respiratory syndrome, what you and I would think of as the flu. Bordetella is just one of them, and there are three very specific other ones and you can vaccinate for one of them. But the reality is that even in the most well-vaccinated dog against Bordetella, you're not going to be able to completely eliminate the transmission of upper respiratory disease in dogs because there are components of that disease that we have no adequate vaccine for.
Wow.
And so, it's just that. Now, that's very specific to your knowledge instead of the average client. But there is no way to 100% protect these dogs. But if you're going to protect them maximally, you're going to vaccinate them at least 3 to 4 times a year.
Wow, that's wild. Okay, I want to switch gears again because and I know we don't have a ton of time. Do you have a little bit of time to spend a little over the hour that we have planned together by chance?
Sure, you betcha.
Okay, wonderful.
You
Because I
bet.
really want to touch on rapamycin.
Okay. All right.
Rapamycin definitely came on, like, hit me and a lot of other people. People were sending it to me left and right. I think because it's just now, has a trial for it just now started? Or I don't know why all of a sudden it was just all over the internet, all over social media. It was on the news. And it sounds amazing because it's an injectable drug.
Nope.
Not
Oral.
injectable. Okay, it's oral,
Yeah.
okay. But it's a
Yeah.
drug, and it's known as the longevity drug, right? We're trying to increase the lifespan of our dogs, which sounds
Yeah. So okay. So let's talk. Because I think you might be talking about a couple different things at
okay.
once.
Okay.
Rapamycin has been in the longevity focus for probably 10 to 12 years now.
Right.
And it started on the human side and it's trickled down into veterinary care. I take it on a weekly basis and I give it to many, in fact, probably most of the pets under my longevity care.
Okay.
Why? Because it's been proven to extend the lifespan by up to 14% in every mammal species studied to date. And the ways it does that are by reducing cancer incidence, reducing inflammation, like your boy Sully's arthritis, and by supporting heart function. Those are the big 3 advantages for rapamycin. And it does these things very safely. There are really no contraindications to its use. It plays well with virtually every other drug on the market. And the worst that I have seen in my practice, and I probably have just over 500 dogs and about 250 cats on rapamycin at this point. And the worst thing I have seen is that their poop can sometimes loosen during the initial few administrations of the drug, but that almost always tightens right back up again. So if you're looking for a very safe way to extend your pet's lifespan by up to 14%, rapamycin is a great choice for you because it does reduce cancer incidence, it does reduce arthritic pain, and it does support normal heart function. Now, there's a new drug coming out from the company Loyal, and it's scheduled to be deployed in 2028. And we think that it is probably rapamycin as well. And it just goes by right now it's just in the introductory phase. It's going through a bunch of studies. So it's Loyal or LOY-001 or 002. There are a couple different formulations. And the reality is that many people are asking about that right now, but it hasn't even gotten through the permitting process yet. So we're at least several years out. Rapamycin is the one drug that you can safely bank on right now to help improve your pet's longevity.
How was that discovered? Because from my research about it, because when it came out, I was like, I need to know about this. Like, it sounds amazing. If I can help my dog live 14% longer, I'm going to do it. But just like any other sort of pharmaceutical drug, I scrutinize it, I look into it, and you kind of answer one of my questions there, like, what are the downsides? Because I'm not going to give something that's going to have really big negative side effects for maybe this one thing that it might help out with. Rapamycin was first, like you said, it was in the human sector, and it's a bigger dosage. It's an immunosuppressant, and it's supposed to help the body accept organs after organ transplant. Is that correct?
Yes.
So at what point was somebody like, huh, I wonder if this will help my dog live longer?
I think it was just an accidental finding. If
Okay.
you listen to Peter Attia's podcast, he had a couple of folks that are very, they've been rapamycin researchers for a long period of time. And I forget what the, the come to Jesus moment was, but I think it was just the byproduct of another study. And what they found is that in mice, for instance, the rapamycin extended lifespan by up to 25 or 30%. And the interesting thing, Stephanie, was that they found that you could use this even in old mice and still get a survival benefit. In
Mm-hmm.
other words, you do not have to start this as a girl of your young age. You can start this as an old fart like me and still see a survival benefit. Once you begin taking rapamycin, and so, as with any other movement, there were probably a few early adopters who began taking it. I've been taking rapamycin now for about 5 years or so because I believe that it does have anti-cancer benefits, which are very important to me. And as a 66-year-old, to be honest with you, I'm paying more attention to my mortality than I did, at your age, for sure.
Sure. Oh, there's so many questions I want to ask, and they just can't, like, bouncing around in my head. I think is it currently now being studied through the Dog Aging Project a little bit more exclusively as
Mhm.
an anti-age
Yes.
sort of deal, right? And you said, I think you mentioned earlier, has it been studied for the past 10 years, or is that something, I think it's called Triad, right? That's just something that just kind of recently started to look at rapamycin specifically for that purpose.
Yeah, you're exactly correct. And this is envisioned as a decade-long study. And the hard part is that they lost their funding last year. They
Oh.
lost their NIH funding. And so it went dark for a period of about 8 months. And that funding has since been restored through a combination of public and private funds. But basically, what they're looking at, Stephanie, they're trying to follow these dogs, so a diverse population of dogs, for about a 10-year period, not just to fully evaluate their dog's health, but also because we think that in most respects, the arc of a dog's life mimics that of your life or mine. Dogs are kept in the same environments. They're often sleeping in the same bed. They're being fed many times the same food that you and I eat. They're jumping in the same car. They're exposed to the same risks. And so the Dog Aging Project has two different goals. One is to understand more fully how our dogs age, and the second is to learn what we can apply from that knowledge to human aging as well.
Gotcha. Okay, cool. I like that. I like
The
looking
hard,
at
the,
drug force, but yeah, go
Yeah, and
ahead.
I'm sorry, I'll throw one other fact at you, and that is that because it's a decade-long study, we're probably, I think, 4 years into it at this point in time. So let's say we have another 5 or 6 years to go, and then it's going to take probably 2 or 3 years beyond that to synthesize the diet and get it out into the market.
Hmm.
So the unfortunate truth for your boy Sully, the unfortunate truth for my dog Annabelle, is that we won't have that knowledge in their lifespan, but
Yeah.
we'll be able to use that for future generations of dogs. Instead, what we can do right now is to use the best science available to us. And the best science right now suggests that rapamycin and a second drug, acarbose, are probably the very best longevity molecules that we have at our disposal to help our dogs and cats live their longest life.
From the research that I was able to do, it was kind of compared, using rapamycin was kind of compared to the same effects of like intermittent fasting. And in the sense that whenever the body is not too busy digesting, it has a chance to repair and, clean up the bad cells and different things like that. So why consider rapamycin instead of considering something more like an intermittent fasting schedule for your pet?
The reality is both. I mean, but intermittent fasting comes with a cost, doesn't it? And
Yeah,
so
I can
one thing
imagine.
we should clear. Yeah. One thing we should clear up is the use of intermittent fasting. By definition, the accurate way to describe intermittent fasting is when you and I are fasting for days at a time on an intermittent basis. So maybe we do it once this month or twice next month or whatever.
Mm-hmm.
Most people mistakenly use intermittent fasting to think, well, I'm just going to eat my food between the hours of 8 a.m. and 1 p.m., which is more accurately known as time restricted feeding. So if you're just simply compressing the window of time that you eat, that is not intermittent fasting. That is just simply time restricted feeding. If you're using the phrase intermittent fasting, it means that by definition you're normal for a period of time, and then you all of a sudden stop eating for a period, and typically a couple days anyway, and then you come back on. So you repeat that cycle. And
Okay.
so the hard part is that, intermittent fasting and, the whole calorie restriction in human medicine really became a thing 5 years or so ago. But people hate it.
Yeah, it's hard.
People hate it, Stephanie. Yeah.
Yeah. Yeah.
And so if you can take a drug to mimic that, the reality is people will always do that.
Yeah.
100% of the time. And so I would not be the one to explain rapamycin's mechanism in every detail to you, but you're exactly right. Basically, rapamycin acts as an inhibitor of a particular pathway within the body. And by inhibiting that pathway, it does mimic calorie restriction. Let's just use that term. You're eating fewer calories, and that is inevitably healthier for you. It does give your body a chance to go through the autophagy process, where you're cleaning up older non-functional cells. We think that on an evolutionary basis, humans and dogs both are best designed as intermittent feeders, where you and I might have to skip a meal because we weren't able to find that meal, or we weren't able to eat for a day as we were traveling or whatever. We think that actually is the healthiest way for us to eat, the healthiest way for our dogs to eat. But the days of 3 squares a day, I mean, that's a big problem from a longevity perspective for both us and our pets.
I think one thing I want to clear up for the listeners, like I mentioned, rapamycin was first approved as an immunosuppressant. When we're using it as a longevity support, it's much smaller dose.
Hmm.
Correct?
Oh yeah, yeah. It's about 30 to 40 times the lower dose.
Okay. I think when I first read about it, I was like, well, I'm not going to give that to Sully. Like, this is a
Yeah.
man who
No,
he's
I
60 years
understand.
old. He needs his immune system. He had a cancer scare, I think, 2 years ago now. Like, my last thing that I want to do is suppress this man's immune system. So knowing that it's a much lower dosage, that's not having that immune system suppression effect is very good to know. You mentioned that it's oral. How is it something that a dog should take daily, weekly? Like, what does that kind of look like, or does it depend on the dog?
It depends not so much on the dog, but we think there are two different strategies, and they both came out of Dr. Matt Kaberlin's work. Dr. Matt Kaberlin, he's kind of the OG, the original guru on rapamycin for longevity. And there was a study that he did back in 2017 at the University of Washington, which suggested that rapamycin given 3 times daily. I apologize. Let me try that again. 3 times weekly.
Oh, okay.
So let me emphasize that 3 times weekly offered these dogs in the study a number of benefits without any negatives whatsoever.
Wow.
And to this day, that is the only study that has been completed in dogs around rapamycin. So we personally recommend the use of rapamycin on a 3 time weekly basis for the patients in our care.
Okay.
Now, the current dog aging project is using a higher dose, but less frequently. And
Okay.
so not to bore you to tears with it, but the dose that is currently bandied about for us is zero point 0.1 mg per kg given 3 times weekly. Dr. Kaberlin in his dog aging project is currently using a higher dose of 0.15 mg per kg given just once weekly.
Oh.
And the rationale there is a couple different things. Number one, he was worried about the pain in the ass value for pet parents like you giving medication 3 times weekly over a decade-long experiment. And so he felt that a one-time weekly dose would give pets would make it easier for pet parents to give that drug. And then the second component was that the once weekly dosing is what is currently recommended in human longevity science. And so again, he's trying to learn what parallels there are between dog aging and human aging.
Okay, very cool. I need to go look up that study because I'm very interested to read it more.
Yeah, so Kaberlin and Urfer coming out of the University of Washington. Urfer is URFER and dated 2017. So,
Writing that down. You mentioned hardly any negative side effects, maybe a little bit of loose stool that tends to fix
hmm
itself right up. And you also
hmm
mentioned, I mean, obviously good efficacy. What are the things that pet parents and you are actually seeing as markers of success? Are we seeing blood work change? Are we seeing just physical differences? Like, what does that look like that we know that it's working?
Well, so you just rang the bell for the best question of the day. And so I'm going to answer your question in just one second. But in both human veterinary, let me try that again. In human longevity science and in veterinary longevity science, the biggest problem, Stephanie, is that we do not have an accurate aging biomarker.
Mm.
Now, I can test the hell out of your kidney function. I can test the hell out of your immune function and know exactly what is going on by looking at several different blood parameters. But there is no blood parameter at this point in time which tells me that you, Stephanie, are going to live 40 years or 35 years or 30 years or whatever the case may be. There are billions with a B being spent on that quest right now
Yeah.
because there's no way to tell whether the intermittent fasting that you've spoken about, or this longevity molecule, or this dietary practice has objectively has a benefit for us as individuals or for the pets in our care. We just simply don't have any way to accurately measure it at this point in time. So that is my overarching statement. What I would tell you is that a majority of dogs that I deal with right now are have cancer. And so I measure success by having them here next month and the month after that and the month after that, sometimes in direct contrast to the lifespan that was estimated for them by their cancer specialist. So in a couple instances, I've seen 3 to 4 dogs who were supposed to live 3 to 4 months live over 4 years
Wow.
on rapamycin therapy. Sure, these are anecdotal. I'm not saying that in every case this is going to work, but I would tell you that clearly, on an anecdotal basis, I've seen reductions in pain and I've seen increases in cancer lifespan associated with the patients on rapamycin. One of the things you should also understand, I know this is a dog-centric podcast, so I'll make this quick, but one of the most common cat diseases is a disease called hypertrophic cardiomyopathy, or HCM. Affects 1 out of 6 cats. 1 out of 6 cats will die from it in their native environment. And for 38 years of my veterinary practice, when I told you your cat had HCM, I was just basically handing you a shovel and telling you to go dig a hole. I had no way to stop that. Rapamycin stops hypertrophic cardiomyopathy in cats. And so that's one of the single biggest indications for its use right now, are pets with cardiomyopathy.
Would you say, like, when is the best time to consider rapamycin when we're kind of already have a cancer
Yeah,
diagnosis?
you're on a roll, man. You're on a roll. That's question number two that just rang the meter, because we don't know.
Yeah.
We don't know. I mean, in humans, we don't know when the best time to start is. We don't know what the optimal duration of therapy is. Now, I would tell you that at this point, logically, now, and I'm going to separate cancer or heart therapy out, because logically, the sooner we get started on rapamycin therapy for those patients, the longer they will live.
Hmm.
Is there a logic to you taking rapamycin at your point in life? At this point, absolutely yes. According to the science, we know we have it at our discretion. Why wait until you're 66 like me? This is a drug, a molecule that will suppress cancer in your system, that will reduce inflammation in your system, that will help your heart function. Why not take it? But there's a huge debate right now. And let's be clear, to the best of my knowledge, Stephanie, I am the only veterinarian who is prescribing rapamycin for pets.
Okay.
Let me repeat that. I'm the only one. There's no other veterinarian that specializes in longevity science for pets. But there's a huge controversy right now in the human longevity market about, do you take rapamycin for treatment or you take rapamycin as a preventive?
Yeah.
And I take rapamycin as a preventive at my age. And based on current science, I'm suggesting that you do the same. And I would extend that to the pets in our care.
Okay, very good. Well, I really appreciate you speaking very candidly about rapamycin. I think even you and I were emailing each other, I kind of told you like I'm gonna grill you on that because I have
I
so
got
many
no problem.
questions.
And at the end of the day, we can disagree and still be pals. I mean, that's one of the
Yeah.
things that I think has been lost in today's society. Um, you know,
Amen.
and
Yeah,
so
but I think
yeah, I mean, that's a subject for a different day.
that's a whole nother podcast for sure. But yeah, I think that, I look at it a little bit more with an open heart, I guess. Knowing that someone like you're someone that I didn't really know many things about your practice. So this was a podcast that I was kind of entering like, oh, are we going to agree on a lot of stuff? Are we not going to agree on a lot of stuff? And kind of like you said, we can still be friends, but you and I do agree on a lot of different things. So the fact that this is something that you're not only recommending, but something that you're doing yourself, I look at it with a little bit more of like okay, that sounds like I might be able to get behind that. And like I said, I'm always happy to explore something that can have a positive effect without having too many and, depending either too many little ones or a few really big negative side effects.
I
That's
understand.
always really hard to deal
I
with.
understand. Yeah, and so, it perhaps is the way to close. I mean, if you and I were to summarize your boy Sully's longevity strategy, I would think hard about dietary care. You and I have already spoken about this. I would look at ways that we can minimize inflammation in the play, in the exercise that he gets. What can you do in the house? What can you do outside the house to both minimize the stress on his joints and, for instance, minimize toxins in his environment? If you are taking him on an outside walk, you don't want to go to a golf course where they're using Roundup and Weed and Feed and all these other projects. If you're not seeing weeds where you walk your dog, you got to question why. You got to question whether that's the right approach for your dog. You would be best served by having anesthetic dentals done on him at least once a year and probably twice, because we know the pain of a toothache. But more importantly, we know that the cost of oral bacteria is not just a toothache, but it's heart disease, it's kidney disease, it's eye problems and cancer. I would suggest to you that early diagnostics, running blood panels and urine panels on him a couple times a year, would be the very best option for your boy, because if we catch this stuff early, you and I can solve it early
Yeah.
instead of getting to the point where it's not curable. And these are all things that you can do without spending a great deal of money. The dental care, well, maybe not so much these days, and then we layer in supplements specific to your boy's needs. And then finally, we talk about prescription longevity drugs. But there are a number of different strategies that don't cost very much. They just require a gentle reset in the way you and I look at our dogs, what they do, and the food that we give them to help them live their longest and best life.
That is gorgeous. I think you just wrapped up the entire episode so gorgeously in a nice little bow. That was wonderful. You said earlier you take telemedicine, so you can work with clients virtually. And your website is helppetslivelonger.com, correct?
Let me try that again. Our daily website is www.helpingpetslivelonger.com.
Perfect.
helpingpetslivelonger.com. Now, for your podcast listeners, I also have a second website set up, and that is just simply www.freevetcall.com.
Okay.
freevetcall.com. And it's just a one-page website, Stephanie, that allows your listeners to go in and set up a 10 to 15 minute consult with me at absolutely no charge. There is zero charge for this. We can talk about vaccines, we can talk about diets, we can talk about rapamycin, whatever they want, because we're all in this together, Stephanie, in the game of pet longevity. Who doesn't want their pet to live longer? And I will help you if I can.
I love that. Well, Dr. Kevin, thank you so much for your time today. I will definitely be linking both of those things in the show notes. So listeners, if you're interested in working with Dr. Kevin, by all means, hop into the show notes, go check out those links. Or if you happen to remember them just by hearing them, by all means, go and visit Dr. Kevin and get that free little 10-minute, 15-minute consultation. I think that's amazing. Thank you so
There you
much,
go.
Dr.
All
Kevin.
Thank you, Stephanie. I appreciate everything you're doing for the dogs and cats of the world.
Oh, I appreciate that. All right, listeners, we will catch you guys on the next episode. Now, that might be the end of the episode, but the fun doesn't have to stop here. Follow us on social media. I'd love to connect with you. We have quite a few social media platforms. For nutrition and holistic pet care tips, follow me on TikTok and Instagram at Steph the Pro Dog Mom. You can find fun training tips on Facebook, TikTok, and Instagram at Pup Pup and Away SA. If you're in San Antonio and you want to bring your dog to us for boarding, training, socialization, and nutrition, come find us. But if you're not in San Antonio, we do training and nutrition sessions virtually. Yes, they can be just as effective, I promise. Please rate, review, and subscribe to my podcast on whatever platform you listen on. And please, please, please share with a friend. The positive reinforcement of knowing people actually listen to this and find it valuable helps motivate me to keep on recording. We'll see you guys at the next episode.